Just be happy with who you are. Just be happy with who you are. Just be happy with who you are.
Hi, and now we're into part 2 where we're going to look at sleep and wake disorders. Now, sleep is a normal biological function, yet how do we do it? Why do we do it? Well, sleep is a restorative, and we seem to need it. Try not sleeping to see how important sleep is. Most of us get tired at night and go to bed and can sleep, no problem. However, some cannot and have some problems getting to sleep or remaining asleep, and affects their life at work, interpersonal. In many ways, these are in many ways it can affect work, your personal life. Now there are there are by the DSM-5 known as sleep-wake disorders. Okay, the diagnostic category representing persistent or recurrent sleep-related problems that cause significant personal distress or impairment in functioning. So there's that. Remember in week 1 we talked about some conditions by which things are considered abnormal, and personal distress and impaired functioning were two very important ones. And so for people who have sleep disorders, it affects them in a manner that affects them personally. They get upset about not being able to sleep and perseverate on it, or that they may have impaired functioning as a result of not having enough sleep. Let's consider Jim. He's a student with a history of having sleep problems. He reported that he never slept well and had trouble falling to sleep and waking again in the early morning. Now, since he started school last year, his sleeping problems have grown worse. He would lie in bed awake until early morning hours thinking about school, getting only 3 to 4 hours of sleep in a typical night. And in the morning, he had difficulty getting out of bed, and he was frequently late for his early morning class. Now, Jim's sleep problems and their interference with his schoolwork were causing Jim to experience increasingly severe depression. In addition, he recently reported as having a severe anxiety attack that woke him up in the middle of the night. All of these difficulties caused him to be increasingly isolated from family and friends, who finally convinced Jim to seek help. Not all of us have these kinds of issues, but the sleep-wake disorders, they form a diagnostic category representing persistent or reoccurring sleep-related problems that cause significant personal distress and impaired functioning. And there's that statement again. It is with the use of a polysomnographic recordings, that's the PSG, which simultaneously they measure multiple physiological responses during sleep or attempted sleep to use to assess sleep disorders. So you would go to a sleep clinic perhaps and be set up on a monitor with electrodes, if you will, stuck to your head, where they could monitor brain waves, they could monitor respiration, blood flow, heart rate, some of these very basic things that would help assess whether or not there's an active sleep disorder occurring. There are a number of sleep-wake disorders, and we're going to consider insomnia disorder, hypersomnolence disorder, narcolepsy, breathing-related disorders, circadian rhythm disorders, and parasomnias. And we're going to begin with an insomnia disorder. People suffering from insomnia disorder have difficulty falling asleep, remaining asleep, or achieving restful sleep. University of Ottawa psychologists found that high levels of anxiety were associated with moderate to severe sleep-onset chronic insomnia. High levels of life stress, shift work, heavy drinking, or cannabis use, obesity. Now these and other factors can all contribute, but do not to not getting a very good sleep. When we consider chronic insomnia, it involves having difficulties falling asleep, remaining asleep, and getting restorative sleep for a period of at least a month or more. That doesn't mean 3 or 4 times in a month. It means nightly for a month or more. You can only imagine, if it doesn't affect you, how that might affect your life. not getting enough sleep, not getting enough restorative sleep, it could be very, very significant. Now, hypersomnolence disorder, people suffering from this disorder, it's a persistent pattern of excessive sleepiness during the day that is observed. These persons do not feel refreshed after a daytime nap. This is not the kind of sleeplessness we might have from time to time where we're taking a nap can restore us. This is a chronic where naps are not helpful. And so most of us really don't have those kinds of experiences. This sleep and wake disorders aren't common. Not as common as like every third person will experience this. So this is an important distinction between our own having some difficulty sleeping from time to time and then the reality of somebody having a sleep-wake disorder. Now, a very significant one that affects very few people, but it certainly occurs, is what's known as narcolepsy. Narcolepsy is a sleep-wake disorder characterized by sudden, irresistible episodes of sleep. That is to say, you sort of have a sleep attack. You just drop off to sleep. It's accompanied by a cataplexy, which is a brief, sudden loss of muscular control, typically lasting just from a few seconds to as long as 2 minutes. So when this sleep attack occurs, the person goes directly into REM sleep stage. So you don't go, you skip 1, 2, and 3, and 4, and you get right into REM sleep. And as you can remember from our consciousness, state of consciousness lesson, REM sleep is we're dreaming. I had a student once in my class who experienced narcolepsy, and she brought a pillow into class and a friend. So when she dropped off to sleep, the pillow could be used to protect her head from slamming onto the desk. And she would be in mid-sentence sometimes and directly into sleep. It was very debilitating for her. Now, there is medication that you can take, but not all people feel that the effects of the medication, not just the improvement of the narcolepsy, but the other effects, is worthwhile. And we'll get into that. Now, there are another category of sleep-wake disorders, and these are the breathing-related sleep disorders. Now, people with breathing-related sleep disorders experience repeated disruption of sleep due to respiratory problems. Now, these frequent disruptions of sleep result in insomnia and excessive daytime sleepiness. The term apnea means the temporary cessation of breathing. That means you temporarily stop breathing. That's what the term apnea means. Obstructive sleep apnea, hypoapnea, is a type of breathing-related disorder involving repeated episodes of either complete or partial obstruction of breathing during sleep. And it can be quite debilitating. In fact, it can be quite damaging. Now, again, we'll look at treatments in a minute. Now, the term or the disorder, circadian rhythm sleep-wake disorders, these circadian rhythm sleep-wake disorders are sleep disorders characterized by a disruption in our sleep caused by a mismatch in sleep schedules between the body's internal sleep cycle, that's our circadian rhythm, and the demands of the environment. The disruption of normal sleep patterns can lead to insomnia and hypersomnia. And so in this instance, it's all based on our circadian rhythm. And when it gets disrupted to the degree that it affects our everyday life and our functioning, that's when it's an issue. But this is based on the circadian rhythm being disrupted. Another group is what's known as parasomnias. Now, parasomnias are a category of sleep-wake disorders involving the occurrence of abnormal behaviors or psychological events during sleep or at the transition between wakefulness and sleep. It is further divided into disorders associated with REM sleep and those associated with non-REM sleep. Now, nightmare disorder, it falls in this group. It's a reoccurring awakening due to frightening dreams or nightmares. Nightmares typically occur in the REM sleep, and this stage of sleep usually involves the type of paralysis, which, handy as jumping out of bed to run away, could prove quite dangerous. So it's kind of nice that during these nightmares we enter into a stage of paralysis so that we don't jump up and run away. Then there's also a non-rapid eye movement sleep arousal disorder involving the recurrent episodes of complete arousal during sleep that are accompanied by sleep terrors and sleepwalking. For those of you who might have children, sleep terrors, you'll recognize this as someone while they were asleep will yell out in a piercing scream. More often, like I mentioned, in children, they'll often sit upright quickly and be sweating and disoriented and still be asleep. After a while, the child will fall back to sleep, remembering nothing about what happened in the morning. Sleep terror involves repeated episodes. Children will typically grow out of these, although some small percentages are affected in adulthood. Sleepwalking, again, this is a behavior of walking around that occurs during sleep that normally oughtn't happen. So sleepwalking is repeated episodes of someone getting up and walking around while remaining completely asleep. This occurs during sleep stages. They tend to have a blank stare and they don't usually bump into things. Their eyes are open. Accidents do happen, mind you. An awakened sleepwalker will not be harmed by waking me up. They may be somewhat disoriented, but they'll be fine. Then treatments for sleep-wake disorders, there's a variety of options. A biological approach, the most common pharmacological method for treating sleep-wake disorders in Canada is the use of sleep medications called Insomnia. However, because of problems associated with these drugs, non-pharmacological treatment approaches, principally cognitive behavior therapy, have come to the fore and are being looked at stronger. Psychological approaches, well, mostly it's limited to treatment of insomnia. It has a limited approach in terms of any of the other strategies. Like cognitive behavior techniques, they focus on lowering states of physiological arousal, so getting your heart rate down, quieting your brain, and relaxation techniques, modifying maladaptive sleeping habits, how you get ready for bed and the preparation, and changing dysfunctional thoughts using relaxation techniques, stimulus control, and anxiety management training. As you could imagine, there is cognitive restructuring, and this is substituting of self-defeating or maladaptive thoughts with more rational thoughts. You might want to check in the closer look example in your textbook at the end of the chapter for some examples of that. Now that's another quick review of just looking at the wake sleep disorders. I hope this has been helpful. Good luck and keep up the good work. We're getting near the end. Thank you, everybody. Bye now.